Hello, my name is Alec Burnett, and for this assignment, I chose to watch a TED Talk called "I'm Not a Monster: Schizophrenia," and it's by Cecilia McGow. Um, so she is an astronomer, activist, and writer. Actually, during the time of this video in 2017. So, yeah, writer at Penn State, and also majoring in astronomy and astrophysics. Physics. So Cecilia has schizophrenia. She talked about in her TED Talk her dealings with different hallucinations and delusions, and also clarified just for me too. Not everyone with schizophrenia um, has delusions and hallucinates. So that was just a good little tip I learned from that. Also, just during her TED Talk, she talked about just the stigma surrounding schizophrenia, um, and really just the importance of compassion and just yeah, she was trying to share her story about schizophrenia and also trying to um, really just make sure everybody's case is different and making sure they're getting the proper type of care. Um, Also, she launched the nonprofit. It's now called Students with Psychosis. And at the time, it was the only nonprofit focused on empowering college students with schizophrenia. Thought was a good population for me because I'm interested in helping high school, college age, but we'll see. I'll be helping everybody as a therapist. Um, I think just relating to just how it relates to coercive mental health, I'll just share kind of the story from her video. Or her TED Talk, but it talked about how she had a brief hospital stay in the ER because she was having hallucinations, just trouble, difficult dealing with her schizophrenia. Um, and she was in college at the time. She went back to the dorm um, and talked to the RA and some of her roommates who were concerned because she was gone overnight at the ER. Um, and they were able to talk, and she decided, as well as with help from her roommates and the RA, and there's they listed it was a can help person, so somebody at the college listed it'd be good for her to go have another night at the psych ward. But what came with that was she agreed she wanted to get help, but then police officers came in, pat her down. She had to convince them to not arrest her and put her in handcuffs, and it was a big scene. It was very traumatizing for her. The police car coming by, she's being hauled off in a police car. Friends are seeing her when she passes by the other dorms. But yeah, really just from this experience, she's a big mental health advocate now, and that's just an example of what can happen when dealing with people with schizophrenia. It's just the fear behind that ends up being something like, yeah, the police officers were gonna arrest her when she was very coherent and able to help make her own decision that she needed to go to the psych ward. Um, yeah, just self the therapist thoughts just about this whole video and her thoughts. Really, just for me, just definitely more empathetic. With schizophrenia, hearing her story. Um, Also, just the frustration with just the stigma around it, and just seeing like my future role as a therapist, making sure I have that responsibility to take care of everyone, and especially people with schizophrenia. Yeah, her experience really highlights, it's dehumanizing how being taken out of your dorm like that and not being your autonomy not being valued at all. Um, yeah, and I think just as a future therapist, excuse me, uh, want to have a non-biased, open space, and just realizing, like I said, that coercion when something like that happens, a lot of it's out of fear. So trying to best understand really each person's story, and also have a general, idea of um, schizophrenia and other psychosis. I think just hearing, yeah, the TED Talk, I think it just reminds you just the importance of listening first, treating individuals as people, and not just diagnoses, of course, and being able to, yeah, fully hear their story. And yeah, I'll probably talk about it a little bit too. Um, Really, I believe that therapy should be collaborative. Not just impose, work together to find the best treatment. And that also involves the client's voice, especially the client's voice. They know a lot what they're going through, of course. and just yeah, advocating for treatment that really yeah empowers them, not controls them. And just thinking about yeah, ethical considerations in coerced care. I think yeah, just from the reading, of course, it's very controversial. You know, some argue, it can reduce harm and improve outcomes by putting someone in care, but also, it can bring up trauma and rights for the client, which we want to have client-centered care. We want the client to have input. Um, I think too, just talking about like multidisciplinary care, last lecture. Um, just being able to work with them to find the best care. And that involves getting the client's input, making sure to hear the whole story and have that holistic care to best help them out. Um, yeah, I think, forced treatment, forced medication, that undermines their right to make decisions about themselves. So, yeah, collaboration, like I've probably said a million times so far. Um, and just as a therapist and hopefully with help from other members of the team to help the client out, weigh the benefits of intervention, just how best to help them, yeah, just that collaborative care, um, really collaborative and person-centered, um, but important to respect their rights but also address any safety concerns that comes up, and that's yeah, the most important thing. Of course, to keep the client safe and people safe around her or around them. Sorry, different clients. So yeah, that's all I have. Thank you.